Good morning, good afternoon, everybody. My name is Henriette Jansen, and I'm the Technical Advisor on Violence Against Women Research and Data in the UNFPA Asia and the Pacific Regional Office, and I'm the Technical Lead to the No Violence Against Women Data Initiative that provided technical support to the study in Vietnam. My own journey of witnessing change in Vietnam started in 2005 when I worked with the World Health Organization in Geneva, and we had just published the results from the WHO multi-country study on women's health and domestic violence. In December of 2005, I had the privilege to be invited to Vietnam to speak for the National Assembly. Vietnam was drafting a domestic violence law, and my speech at the National Assembly focused on showing that domestic violence was not rare. It happened in many countries, and it was not embarrassing to have a domestic violence law. But Vietnam had no data at all at the time, and domestic violence was considered a family issue and a cultural, very sensitive issue. But the domestic violence law was passed in 2007. And then only in 2009, I was invited to Vietnam again as the team leader for the first national domestic violence study. And the process at the time was very much driven by the UN. And nobody in the country, and certainly not the government, was prepared for what the study would find. But the findings changed the country and changed how the Vietnam government would speak about and deal with sexual and domestic violence. And then in 2019, Vietnam conducted another study, the second one. And this time it was initiated and led by the government. And it's a big honor for me to present a selection of the findings of the second national study on violence against women in Vietnam. So I will start with some key findings on violence by husbands. And I use the term violence by husbands almost interchangeably with partner violence, because in Vietnam, we found that 97% of women with partners actually were or had been married. In the study, we looked at physical, sexual, emotional violence and controlling behaviors and economic violence, all by husbands. And in Vietnam, as many as 63% of women had in her lifetime experienced at least one of these 5 forms. And 32% had experienced any of these 5 forms in the last 12 months. Looking at each of these 5 different types of violence separately, we see that women were least likely to experience sexual violence by husbands, 13% in their lifetime, and women were most likely to experience emotional violence, 47%, or almost half of all women experience this in their lifetime. And in this presentation, and in much of the analysis, we use the indicator physical and or sexual violence by a husband. And this is the most robust indicator. And we use the combination physical and or sexual violence also for international comparison. And we see that in Vietnam, 1 in 3 women, 32%, experienced this combination physical and or sexual violence by a husband in her lifetime. And it is the same as the global average. In the study, we also collected stories. And this is the story of one woman who was interviewed, and I will read part of it. "This scar on my back was when he hit me while I was sleeping. It broke my bone. I still went to school to teach that afternoon, and I biked with only 1 foot. The traces of this violence are all over my body. My face has been like the map, with many lines and paths." We looked at violence by husbands among women with disabilities, the orange bars, and compared it with women without disabilities, the black bars in this graph. And for each of the 5 forms of violence, we found that women with disabilities were more likely to have experienced violence compared to women without disabilities. And Hoa, who was interviewed for this study, could not walk, and she was beaten by her blind husband, and she could not report the violence because she thought that no one would believe her. Women also experience violence by non-partners, such as other family members, neighbors, teachers, people they work with, and strangers. 11% of women in Vietnam experienced physical violence since age 15 by someone other than a husband or partner, and only 1% in the last 12 months. Both of these rates were significantly lower than the proportion of women who had experienced physical violence by a husband. And most of this physical violence by non-partners was perpetrated by males who were known to the woman, such as family members, friends, and colleagues. The rates of sexual violence by non-partners was also lower than the rates of sexual violence by a partner. 9% of women in their lifetime and 1% in the last 12 months. And almost all of this sexual violence was perpetrated by males who were not family members, such as friends and people at work. And strangers were only mentioned by 1 in 5 sexually abused women, thus illustrating that most abusers are known to women. 4% of women did identify that they had experienced sexual violence as a child before age 15, and most of this was by a known person, such as a family member, a family friend, or a neighbor. For the findings thus far, the big question is probably on your mind now: has this violence changed since 2010? And here you see the 4 types of violence by a husband in 2010 in black and in 2019 in orange. And these types are physical, sexual, emotional violence, and controlling behaviors in lifetime and in the last 12 months. And we see that for almost every type, except sexual violence, in 2019, fewer women experienced violence compared to 2010. And this is true for lifetime and for the last 12 months. And for example, you see the first group on the left, physical violence by a husband. We see that in 2010, the lifetime prevalence rate was 32%, and in 2019, this is lower, 26%. Again, the one exception is sexual partner violence, where we see that the prevalence rate was increased since the last survey, actually since the first survey. For lifetime prevalence, it changed from 10 to 13%. And since the pattern for sexual violence is so different compared to the other types of violence, we can wonder, or we can speculate, if this is a real increase, or perhaps it's the case that women, after many years of campaigns, are now more open about sexual violence. In 2010, this topic was very much taboo. Whether it's a real increase or not, when we combine physical and/or sexual violence in the middle of the graph, we see that the overall picture is one of decrease, from 34% in 2010 to 32% in 2019 for the lifetime prevalence of physical and/or sexual violence by a partner. We saw that fewer women now experience physical violence than in 2010. But the overall prevalence for all ages combined can hide a more complex picture. And digging deeper by breaking it down by age group shows consistently that women of all ages reported to have experienced less violence in the most recent survey compared to the one in 2010. But we also see that the difference is larger among the youngest age groups, those under 40. And this is evidence that we are looking at a generational change. And we also saw this for other types of violence. We also compared how women's attitudes on obeying her husband had changed between the two studies of 2010 and 2019. Women were asked if they agreed with the statement, "A good wife obeys her husband even if she disagrees." And surprisingly, in both studies, we found exactly the same portion of women agreeing with the statement, namely 27%. Interestingly, when breaking it down by age groups, we noted another very interesting pattern. In 2019, if a woman was under 40, she was less likely to agree with the statement than a woman who was of the same age in 2010. But for older women, we saw the reverse. And the positive news of this finding is that we do see that the difference in attitudes between generations is increasing, with younger women now more inclined to support gender equality. The effects of violence on women can manifest in many ways, and we will show here now some of the impact on her health and on her children's well-being. We see here that women with violence, especially women who experience violence during a pregnancy, have consistently higher rates of miscarriages, abortions, and stillbirths. All women with children in the age that they should go to school were asked whether their children had certain behavioral problems: nightmares, wetting the bed, being quiet or withdrawn, or on the other hand, aggressive. And asking this of all women means that we can compare between women with partner violence and women without violence. And the results show consistently that women who had a violent husband were more likely to have mentioned that her children had behavioral issues. And that was true across all the 4 categories here. I also want to say something about women's coping strategies. And that means, do women talk about partner violence? Do they seek help or not? And the most common way for women to cope with violence is to talk to someone. And we saw that 43% of women had said they spoke with a family member about experience of physical or sexual partner violence. Some women also mentioned that they had spoken with friends or neighbors, but alarmingly, half of the women, 49.6% who experienced physical and or sexual violence by a partner, by a husband, had never told anyone about it before being interviewed. And these findings were exactly the same in the study in 2009. One woman who participated in the study said, "You know what? My family is far away. Everyone here already knew my case, so I'm fed up hiding and continuing to endure. However, I covered up from my brothers and sisters." This woman mentions how she has hidden the violence from her family, and now she's ready to get some help. She wants to stop hiding the violence. In the survey, we asked women whether they had asked help from formal services like the police or healthcare professionals. And 90% of women said they had not asked for any help at all. So those who did ask for help most often went to the police or to the People's Committee, and a few others went to a local leader. These were very small numbers, and they were almost identical to the findings in the 2009 study. With the data on women's experiences with violence, with partner violence, combined with information about herself, her partner, family situation, living situation, it's possible to use statistical modeling to identify the factors that independently influence the risk of experiencing violence. And we had almost 40 different characteristics, different variables that were explored in this risk factor analysis. And the factors for the women included age, ethnic groups, education, attitudes. For the men, we had the same similar factors, but also whether he drinks alcohol, if he grew up in a violent home. Factors for the relationship included age difference, income difference, number of children, socioeconomic status. And it was also explored if where she lived, where the woman lived, had an impact on her risk of violence. And of all the 40 variables in the logistic regression, when they were all put in the logistic regression analysis, we saw a number of factors independently related to the risk of violence. And these are shown here in this figure. And they included, from the woman's side, low level of education, but also having a tolerant attitude towards wife beating. But the strongest risk factors were actually not those from the woman's side, but from the husband's side. And these included alcohol use, fighting with other men, and extramarital relationships, all expressions of harmful masculinity. And moreover, if the husband had experienced violence as a child, this was also a significant risk factor for violence against his wife. And finally, at the relationship level, we saw that women who contributed financially more than their husbands to the household income, they were at significantly higher risk of violence. And in the study, it was also the economic costs of intimate partner violence were estimated. And 3 types of costs were estimated. And the first type is productivity loss for the economy, arising from the fact that women experiencing violence often work irregularly, have less focus at work, or even drop out entirely from the labor force. And then the second type of cost was the out-of-pocket expenditures. For example, getting medical treatment, seeking legal help, leaving home, repairing or replacing damaged property. And the third is the indirect cost or income loss to the household, because women and sometimes their husbands do miss paid work, and women are unable to do household tasks and care work. And the most significant cost of intimate partner violence is productivity loss. And working women who ever experienced physical and or sexual violence had about 30% lower income than women not experiencing violence. And this translates to an overall productivity loss equivalent to 1.8% of GDP in Vietnam. Out-of-pocket costs were also significant. Women are losing about a quarter of their annual income on costs associated with healthcare and or replacing or repairing damaged property. And in terms of indirect cost, 1 in 10 working women who experienced physical and or sexual violence missed work for on average about 8 days. I conclude with a summary and recommendations. Current study shows some improvements across almost every violence measure, and since the study 9 years ago. However, there was no evidence that help-seeking behaviors had changed. We have also seen that violence against women affects many women with grave consequences for them and their families and the economy as a whole. We saw that some groups of women, such as women with disabilities and women whose husband comes from a violent family, are at greater risk. But the findings also suggest that change is happening. Fewer women experienced partner violence in 2019 than in 2010. And when breaking down by type of violence, this was true for every type of violence except sexual violence. Especially young women in 2019 experienced less partner violence compared with young women in 2010. And even if attitudes have hardly changed since the two studies, in 2019, fewer younger women believed that a good wife should obey her husband even if she disagrees. In short, the 2019 results suggest that generational change is beginning in Vietnam. And this is very positive, a good news story. In a stakeholders consultation, the findings were discussed and a long list of evidence-based recommendations was developed in the following areas. First, recommendations on strengthening national commitment and action, recommendations on promoting violence prevention, on developing and deploy appropriate, effective and high quality response and intervention solutions, such as integrated services. And in the fourth area, on continuing supporting research, data collection and collaboration to address gender-based violence. Since this presentation had as focus the findings, for details on these recommendations, please refer to the full report. I want to conclude with thanking all the anonymous women who shared their often painful stories and the many people who worked hard to collect and bring these data to life. And here are very fast the names of all the people involved in this study. And I wish the Vietnam women safe travels and all the support they need on this difficult but positive journey for change. Thank you very much for listening.